How can I treat hyperpigmentation?
A common concern for patients of all skin types is the presence of different forms of hyperpigmentation. An accurate diagnosis of the underlying cause for hyperpigmentation is critical for the success of any treatment strategy. I'll discuss some causes of hyperpigmentation which I see frequently and how I customize treatment plans for different skin types in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. A common cause for hyperpigmentation, which I see in my practice, is the result of cosmetic procedures such as laser treatments performed elsewhere. Oftentimes, these situations could have been avoided by the practitioner if certain guiding principles were adhered to. For example, in my practice, I limit the use of certain lasers and other devices on people whose skin type is at greater risk for hyperpigmentation. I frequently see patients who were assured by their esthetician or other type of practitioner that the laser being used for them was safe for all skin types. Unfortunately, their skin reacted in a way that their practitioner did not anticipate. This type of scenario has been a growing issue as aesthetic procedures are being performed in greater numbers by non-physicians who work unsupervised. As far as terminology is concerned, hyperpigmentation refers to darkening of the skin, while the term hypopigmentation describes loss of pigment in the skin. Hyperpigmentation is the result of an increase in the skin pigment melanin. Melanin is the natural pigment in your skin responsible for your skin color. Melanin production in the skin is often in response to some type of stimulation. For example, a suntan is an adaptive response to ultraviolet light produced by the sun. More melanin in the skin protects the skin by absorbing ultraviolet light. In people with lighter skin, in addition to a suntan, there can be the accumulation of clusters of pigment within the skin which can remain long after the tan fades. These clusters of pigment are referred to as solar dyschromias or solar lentigos. Solar lentigos and dyschromias can be approached in several ways. In general, my strategy for this type of hyperpigmentation is to perform the most effective treatment with the least downtime and the lowest risk of complication. My strategy is to disrupt the pigment into smaller particles using a non-ablative laser, such as a Q-switch laser. This approach is actually comparable to the way we treat tattoos, where the tattoo pigment is disrupted into smaller particles. In both of these situations, the smaller pigment particles are metabolized by your body. Another common cause for hyperpigmentation is post-inflammatory hyperpigmentation, commonly referred to as PIH. PIH is darkening of the skin from increased melanin production triggered by, typically, inflammation. The causes for post-inflammatory hyperpigmentation include various types of acne, insect and animal bites, or even scratching the skin. I've been seeing an increase of post-inflammatory hyperpigmentation as a result of cosmetic treatments like lasers, radiofrequency, microneedling, and chemical peels. Although PIH is sometimes seen after aesthetic procedures performed in a more medical or professional setting, there are a lot of people who are dealing with hyperpigmentation as a result of their own at-home aesthetic treatments. For example, it's easy to acquire instruments such as dermarollers as well as medical-grade chemicals for chemical peeling. It's not unusual to see the effects of overly aggressive application of dermarollers or skin infection due to suboptimal sterility practices at home. If your skin is over-aggressively traumatized or infected with a dermaroller, post-inflammatory hyperpigmentation can occur and require further treatment. I often find that people with darker skin may not be aware that they are more prone to hyperpigmentation from the use of dermarollers or the application of chemical peels. For people with darker skin color like mine, I start with educating my patients about the need to apply less inflammatory inducing strategies and to be careful in avoiding anything that's too aggressive. For example, for hyperpigmentation resulting from blemishes after acne or ingrown hairs, I recommend a procedure called HydraFacial. HydraFacial is similar to microdermabrasion, but instead of the application of crystals, the device uses water to more gently remove the top layers of skin. At the same time, active ingredients such as glycolic acid can be used to help facilitate resolution of hyperpigmentation. Treatments can be done over several sessions, gently and gradually, to reduce pigmentation in darker skin types. A very common area of concern with hyperpigmentation is the under eye area, commonly referred to as dark under eye circles. This area where the eyelid skin is very thin at about 0.5 millimeter in thickness. So my approach is to optimize the skin quality with minimal trauma. For over 15 years, I've been using platelet-rich plasma or PRP to help people of all ages and all skin types improve the area under the eyes with PRP. PRP is composed of the wound healing and growth factors that are present in blood and are responsible for healing when you have an injury like a cut. When these wound healing and growth factors are concentrated and applied to a given area, there is an increase in blood supply and collagen production, resulting in better skin quality, making dark under eye circles appear lighter. Depending on the skin type of the patient, I also perform different types of laser treatments, such as a long-pulsed erbium laser, which we refer to as smooth eye treatment. Smooth eye long-pulsed erbium laser is very popular in my practice because there is no downtime when compared to fractional or ablative erbium and CO2 laser treatment. I often do use fractional erbium and CO2 laser treatment when there is significant wrinkling in addition to hyperpigmentation. Applying the same principles for improving eyelid skin, I also use PRP in other areas of the face and neck to help patients with hyperpigmentation improve their skin quality. Since hyperpigmentation is often associated with some type of inflammation or injury, it stands to reason that improvement in collagen and blood supply to the skin can help expedite the resolution of hyperpigmentation. The preparation of PRP is performed after a simple blood draw like you would have when you go for a routine lab test. I customize different strategies to deliver the PRP specific to that patient's individual situation. For example, I inject PRP just below the delicate skin of the under eye area. I also deliver PRP with a unique device that gently creates microchannels in the skin without bleeding, which we call skin boosting. I often combine laser and other thermal energy device treatments with the application of PRP to create a synergy between the stimulatory effect of the energy delivery with the optimal healing process, which is amplified using PRP. This often means that I can limit the aggressiveness of the laser device and reduce the risks of complications caused by higher energy delivery, like PIH. I've also found that PRP placed strategically under the skin can create a glow effect as a result of increased circulation and benefits to the fatty cell layer just below the skin. It's understandable why people who have problems with hyperpigmentation feel that they just want to take an eraser and wipe away the hyperpigmentation in one single session. Although there are situations where I can use a more aggressive modality, such as a fully ablative erbium or CO2 laser for certain skin types, I have found that being strategic and minimizing risk and downtime is better for many people in the long run. Being patient is particularly important for people with darker skin to avoid potentially making a bad situation even worse. A proper diagnosis and a detailed treatment plan, which involves observing the outcomes as treatment progresses and making adjustments accordingly, is the key to long-term satisfaction for my patients who I treat for hyperpigmentation. I hope you found this information helpful. Thank you for your question.